Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemisola because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Good morning, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. Thank you so much for joining me this morning. My name is Gbemisola Boyede. I'm a pediatrician, and I've come today again with a new topic that we're going to be talking about as we discuss things that are important to the health of our children. So welcome everyone once again. If you are listening to me on Fresh Waves Radio or Ask Dr. Gbemi podcast platform, I really want to say thank you so much for joining us and you're welcome. And for those of you who are watching on Facebook, either the Fresh Waves Radio Facebook page or Ask the Pediatricians Foundation Facebook page or the Ask the Pediatricians Facebook group, I also want to especially welcome you. And also for those of you who are watching also on YouTube, you're welcome. For those who are watching live and for those who are going to listen, if you are just watching the repeat episode of the broadcast, I want to especially welcome you. This program is brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is committed to the health and well-being of children globally, especially those in Africa. We are committed to reducing preventable deaths of children. And we do that through our health education and information platforms. And so if you have any question, you are welcome to go to our Facebook group, Ask the Pediatrician on Facebook, and you can ask your questions from Mondays to Saturday, and our professionals, moderators, they will be there to be able to give you evidence-based health advice and information. And so thank you so much. And if you have any topic you would like us to discuss on this platform, anything you think you really like to know about as far as the health of children are concerned, also feel free to send us a message, either on our WhatsApp number or to the Fresh Waves Radio WhatsApp number, and we will try to address it in future episodes. So thank you so much for joining me this morning. And today I'm going to be talking about a condition that's also very common in children, and we're talking about bronchial asthma. Bronchial asthma, or many people just call it asthma. And a lot of people even wonder, do children have asthma? Yes, children can have asthma. And it is so important for us as parents to know about bronchial asthma in children. In fact, bronchial asthma is one of the most common, what we call chronic conditions. So these are conditions that go on for a long time, in children. So in school-age children especially. So it's so important for us to know about it. What is so unique about asthma is that we used to say that parents manage asthma, not the doctors. So usually parents need to know a lot about asthma. If you have a child who has asthma, you need to know more. You need to know how to manage it, because most of the time when there is an attack and all that, we rely on parents to start managing it first. So it's so important for us as parents to know about managing asthma and what to do. And we also need to, there are lots of myths and a lot of superstitious belief about asthma. And I think we'll also try and address that as well today. And so thank you so much for joining us. So let's start with what is asthma, or specifically speaking, what is bronchial asthma? Bronchial asthma is a condition that affects the airway, actually the lungs in children, and is characterized by the fact that there is a what we call reversible obstruction of the airway. There's narrowing of the airway, and but it's not like it's permanently narrowed. It's narrowed for a while, and then it will open up again. So it's a reversible narrowing. And what normally causes the narrowing is that when children with asthma are exposed to any of the usual things that trigger off the episode, it causes the swelling of the airway, or there could be a lot of more mucus, and all those things, causes the airway to narrow and make it difficult for hair to come out, and that is why you tend to hear this wheezing sound, when children are having their attack, because the airway has become narrowed, and so hair going in or coming out is a lot more difficult, and it is then we tend to get the wheezing. And I think that is what many people are very familiar with. When we talk about asthma, then people tend to think about a child who is wheezing, who is making this wheeze is like a musical sounds, and you tend to hear them having that. And so that is when that's what asthma is about. However, it is not all the time that you need to hear the wheeze. I know sometimes you may not hear a wheeze, and sometimes there are other symptoms of asthma beyond just the wheeze. So I don't want us to think that, okay, for people who don't have a wheeze, and that means they don't have asthma. But the first thing for us is to understand is asthma is a chronic condition. When we say something is chronic, it means something that can last for a long time. In fact, something can last a lifetime. In other words, so people who have asthma may have it for a very long time. And sometimes some people outgrow it. Sometimes they still have it even as adults. It tends to run in family. So it's assigned to be a genetic predisposition to having asthma. And the thing, hallmark of asthma is the airway. It has to do with the airway, and it has to do with the fact that the airway can become narrowed for various reasons. Actually, when there's a trigger of whatever is whatever the factors that is predisposing the child to having the asthma attack. But the child already have that tendency, because other people will be exposed to the same factors and nothing will happen to their airway. But for those who have asthma, they already have that genetic or that predisposition for the airway to swell up and to become narrowed. But the good thing is that it will also become, the swelling will also go down and the airway will open up, after the episode. So it's a reversible obstruction or narrowing of the airway. And most time it is characterized by that wheezing sound. Now, there are other instances where children can wheeze and it is not asthma. So again, it is not every child who has a wheezing sound that has asthma, especially in young babies. And that's why a lot of people get the misconception that you cannot diagnose asthma in younger children. We can actually do it, but some children can also, there are other medical conditions that can make a child to have that wheezing sound. For example, bronchiolitis in infants. Also, even some heart condition like heart failure, you can hear the wheezing sound. But what separates all those other conditions from that of asthma is that in asthma is something that is recurrent. So it is not once, it happened once and that is it. It tends to happen again and again. So there's recurrence of that reversible obstruction of the airway. So when you keep having that, then it's more likely to be asthma rather than the every other condition. So now, how do you know it? What are the symptoms? What are the signs that we will see that will let us know that this child is having an asthma attack? Number one, of course, like we mentioned in when we're talking about what is asthma, it has to do with the airway. So there is always that breathing difficulties. So a child who has asthma will be struggling to breathe. They may be breathing fast, but you can see that, and then you hear that wheezing sound as they're struggling to breathe. Because remember what is happening, the airway is narrowed, and air going in and coming out is difficult for the child. So they will be having difficulty with breathing. And of course, you can, with that, you actually wear the sounds. Sometimes it's so loud that even without our stethoscope, we can hear that wheezing sound. Most of us know what I'm talking about, especially if you have had a child who have asthma. But if you don't, you can also go online, just watch video of an asthma attack. You can hear how the sounds, the wheeze, sounds like. And then, but sometimes the wheeze is not so loud that we as doctors, it is when we use our stethoscope and listen into the child's chest that we now pick up the wheezing sound. Sometimes some children may not have difficulty with breathing or wheezing. Sometimes it is just this cough. They just cough and cough. And, especially children that tend to cough at night and then they cough repeatedly, you just keep coughing, coughing, coughing. Sometimes asthma can also manifest as cough, not necessarily only when you hear fast breathing or difficulty with breathing or the wheezing sound. So these are the signs that we tend to see in children who have asthma. And the key thing is that it tends to happen again and again. And I think that is the most important thing for parents to understand, because I do get a lot of questions on our Facebook group. So mothers, parents will say, oh, my child has been having pneumonia, or I'll be having chest infection, and he's always having chest infection every week or every 2 weeks, and it's happening again and again and all that. And they think, why is that having recurrent pneumonia? And I always tell parents that most times children don't have recurrent pneumonia. Yeah, some children can, in some children who have maybe heart condition or Down syndrome, so they already have a predisposition. But a otherwise healthy child who does not have any other health issues should not be having recurrent pneumonia. So most of the time when a child is having this recurrent, in quotes, chest infection or with cough and difficulty with breathing, it could be asthma. But unfortunately, most people, especially in Africa, we see there's a lot of stigma or around having condition like asthma, and so many people or even many doctors who are general doctors may be very reluctant to give children a diagnosis of asthma, so they rather give diagnosis of chest infection, bronchopneumonia and all that. But they will keep, the key thing is that if a child has bronchopneumonia this week, it's very, very unlikely for that child to have bronchopneumonia again another 2 weeks, in another 1 month. So if a child is coming back and again, it is very, very unlikely to be an infection. It could be asthma, and it's something we need to think about, and especially even as parents, especially if there's also family history, because remember I said that asthma is more of a genetic condition, so there's already a predisposition, and we tend to find that there's another person in the family, either mom, dad, or even grandparents or other siblings, who may actually have asthma as well, and so that make it easier for us to get the diagnosis. So those are the symptoms we see in children who have asthma. And the question people always ask, oh, why there's some people always also go around and say, oh, but I don't have asthma, my dad doesn't have asthma, we don't have asthma in our family, why will my child have asthma? So it is, even though there's a genetic predisposition, it does not always mean we will know the person who has it before. And sometimes this genetic condition, which asthma is part of, we call them atopic conditions. They are kind of allergic kind of conditions. So sometimes the other family members may not have the asthma, because asthma is like the allergic condition that is related to the chest and the airway. Sometimes it could be that of the skin. Sometimes, so some other family members may just have the skin allergic, like atopic dermatitis. Some people it may be the nose, they have allergic rhinitis, always sneezing and all that. Sometimes some people it's the eyes, they're always itching their eyes and all that. So we need to take history of allergy generally in the family. So it is not necessary that other family members may have asthma, but they may have other form of allergic condition. But sometimes it's also possible that we may not get any family history. So because sometimes some parents don't know that when they were young that they also actually have it, but they've outgrown it now. So if their parent didn't tell them, they may not know. So you get, oh, we don't have asthma in our family. And now, so why would my child have asthma? It is possible that we may not get that history, but that does not mean your child cannot be diagnosed with asthma. All right, so we don't really know the cause of asthma per se, but we know that there's a genetic predisposition. That is number one. And then the second thing is that there are other things that tend to trigger off asthmatic attacks. So there are things that tend to make children to have asthmatic attack. And like I said in the introduction part, it may not necessarily it may not be something that you will expect it to cause any attack in other people, but in somebody who already have that genetic predisposition, then they are the ones. So we call them trigger or allergens or asthma triggers. So for example, for some people, it is perfume, or any particular smell. So once they smell it, then they can start having an asthmatic attack. And so one of the things we're trying to do is that for families, for people that have asthmatic attacks, you want to tend to reduce using too pungent, perfumes around them. For some children, it is exercise. So once they exercise, then they start having attacks. Some people, it could be cold, even the weather, dropping and getting colder, that could also trigger. So, for example, in sub-Saharan Africa, maybe during the Harmattan period, you may see that people who have asthma may tend to have more episodes. And sometimes it could be even viral infection. So sometimes, that's why sometimes this can be confusing for some doctors, because the children actually have chest infection and then they now have asthmatic attack. So it's possible that when I say recurrent, the children should not be having recurrent pneumonia and all that. And we are now, so sometimes it is the children can actually have an infection, and it is what is triggering the asthma attack itself. So you must be able to separate that. You may actually start with the chest infection and end up with an asthma or asthmatic episode. So chest infection, it could be viral infection, it could be pneumonia, like bacterial chest infection. All of them could predispose a child to having asthma attack. Or even dust, very dusty environment. So sometimes in school, you see children, sweeping, with all, especially in Africa, where a lot of children see in government schools, they sweep and it's so dusty. If a child with asthma, it can actually trigger asthma in such children. Or even walking through grasses with pollens and stuff, it can also trigger. So there are many, many triggers. Even animals like your cats, their danders, the things that come out of their skin and their hair, it can trigger attack. So it's so important for us as parents, so for a child who has a diagnosis of asthma, we need to know what are the potential things that can trigger off attacks. And sometimes half of the solution is knowing as avoiding those things as much as possible. Some food and all that, but usually mostly things that have to do with airways, smoke, perfumes, cigarette smoking, of chest infection. It's a long list, or even exercise. Those are the things that can trigger of asthma attacks. Now, I need to understand that there are difference in medical jargons. We tend to classify asthma depending on the severity. So there are people that are asthmatic that will not have episodes for months and years, until maybe one day they just get exposed to a trigger and then they have a mild attack, and that's it. So it's very rare, very intermittent. Then you also have people that have attacks like every maybe few months. Then you have people that have attacks maybe every few weeks. Then you have people that have attacks almost every day. So it can be, the asthma varies in terms of its severity. And so we cannot don't compare your child with another child, because the severity of asthma in one child may be different from the severity of asthma in another child. Now, even the asthmatic episode itself, when it happens, the severity can actually also be different. So there are people that have asthma episode that they just use their own inhaler at home and they're fine. There are people that have episodes that we have to take them to ICU. Like we need to start breathing for them. That is, they have what we call acute severe asthma. We used to use the um, uh, um, medical jargon like we used to. So those kind of children, those ones need to go to the hospital, and sometimes we use so many medications. We need to give them injections. Sometimes we need to take them to high CU before we get over that severe, very very severe episode. Okay, so what we call status asthmaticus. That was the jargon I was looking for. All right, so it's so important for us to understand that because sometimes children can die from asthma. I know we have heard of celebrities even in Nigeria. I remember one of the most popular musician in Nigeria at a point died from asthma. No, I think no, not musician. It was playwright. I think Amaka Ikwe, she died from asthma. Sometimes so people wonder, like, this asthma, see something so simple, can it kill? Yeah, people can actually die from asthma, and so on. So it's so important for us to understand, and that has to do with the severity. So you can have an asthma episode, you use your inhaler, and you're fine. That is a mild one, but you also have an episode that if that person doesn't get to the proper uh, uh, intensive care on time, that the person may pass on. So it's so important for us to understand the significance of asthma. Now, for people that have the asthma that is just once in a blue moon, they don't need to be on any medication. And I'm still going to talk a lot more about the medication for asthma. For those people that have asthma once in a while, what we do is that we give them medication that they need to just use when necessary, usually the inhaler, what we call like a reliever or a symptomatic treatment. But for people that have asthma regularly, that is weekly, daily kind of symptoms, those people need to be on medication regularly to prevent asthma. Okay, to prevent this, from having severe episodes. Because for people that have asthma regularly and they have attacks almost daily or weekly, it affects them in any way. Number one, they tend to miss out on school. So it also affect their growth and their development, and they will not be able to really enjoy life to the optimum like other children their age. So that is why for those kind of situation, we need to place them on medications that they have to take every day to prevent the asthma episode. So it's so important for us to understand this. The way we classify asthma in terms of you can have intermittent asthma or you can have chronic asthma in which you have it daily, and even then that will be, and asthma needs to be monitored and managed. And like I said, parents are really part and parcel of the management of asthma. And that's what we are going to talk about, the treatment of asthma. Okay, so the treatment of asthma, and we're going to divide it into medications and non-medication treatment. So when it comes to asthma, medication is so important. And we have medications and we also have other form of treatment that are not medication. Okay, so let's talk about non-medication first because I really need to make some clarity. I think the first thing when it comes to non-medication is that we need to have a clear diagnosis of asthma. I see a lot of cases, or I read about a lot of questions where, uh, from reading them, I already know that this child has asthma, but the parents will never agree. I mean, there's no clarity that this child actually has a diagnosis of asthma. And either the parents or the doctors, nobody has come out to clearly say the child has asthma diagnosis. I think it's so important, and it is very easy to make a diagnosis of asthma. If your child, it's maybe tricky for children below the age of 2 years because sometimes they have other reasons why they can wheeze and all that. So sometimes most doctors are very reluctant to make a diagnosis of asthma before the age of 1 year or so. But that does not mean we cannot make it. We can, but many people are very reluctant. But usually by the age of 2, we should be very, very sure in our mind if a child has asthma diagnosis or not. And the clarity of asthma diagnosis further is recurrent. That is the word you need to underline, recurrent. If a child is having these wheezy kind of respiratory issues and it's happening again and again, that is a very strong reason to think this child may have asthma. Two, when we give the child what we call medications called bronchodilators, the episode actually resolve. So once you have those two things, then it is very likely it's bronchial asthma. And it is so important that that diagnosis is made, because if you don't have the right diagnosis, we're not going to have the right treatment. For example, sometimes children have asthma attacks, they don't have chest infection, but because the diagnosis of asthma has not been made, most times the doctors or whoever is managing them just keep giving them antibiotics, whereas the children need to be on bronchodilators or steroid medication for asthma, but we're giving them antibiotics only. They are not going to get better. And that is why the parent will become, oh, the child is, then you're going to go back again in another few weeks, another few weeks. So that is why it's so important for us to make a diagnosis. So if your child is having recurrent cough or wheezing 1, 2, 3 times and no diagnosis has been made, I think I will really recommend you see a pediatrician so that they can be sure is it asthma or not. We need to take it off. That is number one. Number two, parents have to keep diary to know whenever my child is having the episodes, what are those things that happen around that period that trigger health. Is so, so important, because most of the time when we're talking out to parents, the most important thing is avoidance of those things that tend to trigger off attacks. So we normally do some preventive, kind of advice. Generally, we say avoid dusty environment. So somebody who has asthma is not the one to be sweeping dust and all that. And I know teachers may say, oh, the children are lazy, but sometimes you have to give exception to children who have asthma. So you should not allow them to be joining all those sweeping dusty places, even cutting grasses, like some schools operate farms. The children have to be exempted from it, because we don't want it to trigger off the episode. We generally avoid strong perfumes or things that are too pungent or smell, because they can trigger off attacks in those who have asthma. Or even firewood smoke, cigarette smoke, away from them. All right. Then, of course, for each child, some even things using carpets. So instead of using carpets, because they tend to generate a lot of dust, you may want to use like wooden floor, something that you can easily mop that will not generate dust in the house. So it's sometimes people who have asthma have to make a lot of these what I call lifestyle changes. Parents have to be conscious about it. In fact, sometimes if you live in an environment where there's so much air pollution, you may actually have to change houses. You may have to move away. The more rural, the better, because industrial area, there's a lot of air pollution and it can trigger off asthma attacks. So that's another thing that we may need to think about. Some children is cold hair, so we need to avoid it. We need to keep them warm and all that. So it is not the same for all children, but generally you just have to figure out. Sometimes you are able to, sometimes you are not able to. But the more of these things that can trigger off attacks, and the less of it the child is exposed to, the better for the child. So these are the non-medication options. Even things like exercise. Some children asthma are predisposed by their exercises. So we need to avoid those exercises that they can do other things like swimming, they can do things that don't tend to affect their airway, but things like exercises that tend to make them, get wheezy and breathless, we may need to avoid that. So these are the non-medication options. And sometimes this is all some people need, especially for those who have the very, very mild intermittent asthma. That is all they need. They just avoid all the triggers and they'll be fine. However, There are sometimes attacks can happen out of the blue for absolutely no reason. So we need to also be prepared for that as well. So now let's talk about the medication. So like I said, for children who have intermittent asthma, who doesn't have it often, once in a while, once in a blue moon, they don't need to be on medications, on everyday kind of medication. But however, for children who have asthma often, who are having episodes, often they need to be on medication every day to prevent the asthma episodes from happening. So that is also important. So there are two kind of medications we give in asthma. We have medication we call relievers medication. So reliever medications are medication to relieve the child, just like the name suggests, of the acute episode that is ongoing. So the child is having an attack, is wheezy, is breathless. So we give them what we call bronchodilators. They are relievers. Or the idea of that is that they open up the airway, they dilate it, they open up the airway so that air can go in and air can go out. So that's the job of the reliever medications or the bronchodilators. Then we also have medications to now protect or prevent the asthma episode or to control the episodes. So those are the ones that tend to kind of stabilize the airway so that the airway does not swell up all the time and it does not, so it's likely for the child to have an episode to happen. So we call those medications controllers. So the bronchodilators, we are different kind of that, but they are usually what most of us are familiar is what we call the Ventolin or the salbutamol. So it is one of the common, that's one an example. And usually because the problem is in the airway, we want to give the medication straight to the airway. So most of the time in asthma, we want to give medications that are in inhaler form or something that children can like hair or nebulized version of it. So we don't want to give oral medication. Again, this is something else I also see a lot of. Sometimes we give a lot of children all these medication as oral medications and all that. It's not the best. The reason is that this medication also have effects on other organs in the body. So when you give them through the mouth, even though you want it to relieve the airway, it will affect the airway, but it's also going to affect other organs that we don't want it to affect. So it's going to go to the heart, and it's going to make the heart beat faster. So some children don't like. Obviously, most of us we don't like that feeling. So it's preferably children should take their medication as something that they can inhale. So usually preferably given as inhaler. So your salbutamol or Ventolin inhaler is available. And children from the age of 5, 6 can actually use the inhaler very well. And again, one thing with asthma is that we have to teach people how to use this on how our demonstration, because I've seen a video online where a woman went to a doctor and she told the doctor that her asthma is not getting better and all that. And the doctor, how come this is not getting better? Okay, show me how you use your inhaler. And she picked up her inhaler. I'm sure some of you have seen that video. And she just sprayed it into her armpit like a perfume. Oh my goodness, how is it going to work? Because obviously it's not meant to be done that way. It sounds like funny, like a comedy, but it can actually be true that people are not using the inhaler properly. So we need to show you how to use it. And actually, we have what we call asthma clinics. Most hospital runs asthma clinics in general hospital, in teaching hospitals. So if a child has asthma, it's good that they go to asthma clinic, especially for those who have asthma often, that they are the chronic kind of asthma cases. They need to go to the asthma clinic. So number one, we need to check that the asthma is well controlled, and in that clinic we have these nurses and specialists that can demonstrate to you how to use the inhaler. Now, for children below the age of 5 or 6 who are not very good with using inhaler, because there's a technique to using the inhaler, because you are allowing the aerosols or what they want to puff it up the inhaler. You want it to go through the airway. You want it to hold it in the airway to work on the airway. Most children cannot manage that technique easily before the age of 5. So for those children, we use what we call a spacer device. I don't have one now, but I'm sure if you look on our some of our other videos or online, you will see what a spacer device look like. So it's something that we can. It's just basically a space. You can actually create it by yourself by using a bottle. It's just something you can attach to the inhaler, and then with a mask, it end up like a mask. Put it on the face of the child, they cover their nose and their mouth, so that the child can just breathe it in and out. So the child does not have to, breathe in, hold their breath like the way we do for the inhaler and all that. But this time around, for the younger children, they just breathe in and out from the spacer device. So it's something that goes with the inhaler for the younger children. So if you go to your pharmacy and you are getting an inhaler for a younger child, then you should also ask for the spacer device. So they'll give you a spacer device and show you how to connect the inhaler to the spacer device. And the child just breathing and how they don't have to stress. So you puff, if it is 2 puffs, or 5 puffs or 10 puffs, depending on what the pediatrician recommends. You puff it into the spacer, and you allow the child to just breathe in and out and breathe in and out and breathe in and out. And so that is how we use that. However, for children who are on controller medication, most of the controller medication are steroids. They are steroids, but again, we also want to give it as inhaler. We want to give it into the lungs, into the airway. We don't want it to go to so many other places because steroids have side effects and all that. So most of the doses of these steroids or even the bronchodilators, they are very tiny. But if they go straight to the place where we want to go, we want them to go into, which is the airway, it's better. But if you have to give it orally through the mouth or through injection, we have to give higher dose, and it goes through many other parts of the body, and it can cause issues. Now, it's so important because parents, you must have the medication with you and you're the ones to give it. So usually we always have what we call an asthma action plan. So the asthma action plan is saying this is what you should give every day, and then this is what you give when a child has an attack. If your child doesn't have attack often, we only give you the blue inhaler or the Ventolin inhaler. So you just have that one. If the child is feeling like attack is coming or the attack has come, you just use the child use the inhaler or use the inhaler with the device, the spacer device, and that's it. But if a child is the child that is having symptoms every day and is on controller medication, they have to take their medication daily. So those ones, you have to use the medication daily. And then when there's any acute episode or an attack, then you have in your plan, this is what you need to do. It's also important that the school also know what to do. The child should always have their inhaler as well with them in school at home as well. So it's so important that the school, the parents, the doctors, we are all working together. And the best way to work together is to have that plan. So they know that if we have done this and this is not getting better, then this is the next thing to do. We are calling the ambulance or we're taking the child to the emergency room. So all those plans needs to be in place. So it's so important. And this medication, if your child is on medication that's a controller medication, you have to keep taking it. Don't just stop it. This is a medication you don't just stop. And that's why you have to go to asthma clinics, maybe every few months, and the doctors will check again. Is the child getting better? Do we wean off the medication, or do we still need the medication on? Some, like I said, some children outgrow their asthma and they will not need medication anymore. Whereas some people, even as adults, they keep on having their asthma attacks, and those are the ones that we need medication. So it is so important for us to know about this. So the question is, how do I do? How do I go to the hospital if I think my child has asthma? Like I said, most general hospitals, most teaching hospitals have asthma clinic. So if you think your child has asthma, you can go to them. They know the test to do to confirm the asthma, and then they can, if they will, ask you a lot of questions to be able to classify your child into whether it's something that just need intermittent, like you just have your medications that when you need it, when the child is having an attack, you just give the something to control it or to stop the attack. Or if your child is having so much symptoms and it's really impacting on the child, they give you something that the child needs to be using daily to prevent the attacks from happening. So it's so important that your child is registered with any of those doctors in the asthma clinic for children, and then you go for regular follow-up. So like I said, you as the parent, you need to be very, very aware of asthma and all that, so that you are now to manage it and what to do. So it's so important. So let's just quickly run through what will you do if a child is having an episode of asthma attack. I believe that you should have your the blue inhaler, the bronchodilator, or the ventilator inhaler, or the salbutamol inhaler. They call it different names, different brands, but you know what I'm talking about. You should always have that at home, even if your child is not the everyday asthmatic kind of person. Everybody should have that one as long as the child has asthma, and it should always be available. You should just make the child to sit up comfortably, and then you can get the um the inhaler, the blue one, out, shake it, as shake it properly, and then you can just give the child the pops. Like I said, if it's a child that is um if it's a child younger than 5 or 6, you need to get a special device so that you attach your um, inhalers to the special device. You put it always end up like a mask. You cover the child's mouth, and you put in one puff, let the child breathe in for like 60 seconds, then put the next one, let the child breathe in. But for the older children, they can just puff it straight in. There's a hold the breath in and allow it to stay. And then you wait and see whether the child's breathing better or not. If the child is not breathing better, then you may want to take the child to the hospital. Okay, so that, because like I said, some attacks could be very severe, and so sometimes when you get to the hospital, we may have to put the child on give steroid like hydrocortisone. That will help us to reduce the narrowing of the airway faster. And sometimes we may need to treat any trigger, like maybe it's a chest infection that is causing the trigger of the asthma. We need to treat that. Then we may still need to give the child steroid for the next 3 days or so, and ask you to keep on using the inhaler. Sometimes some people have the nebulizer. It's the same thing inside. The nebulizer is more complex because you need to connect it to electricity, and then you put in the salbutamol nebules and all that. But it's also another way of doing it. But especially in Africa, where your electricity is not really always reliable, it's better to have this inhaler and the special device, because that you can always use. Now, let's talk about a few things. I just want to address some myths. I think I've addressed some of them already as I was going on with the discussion. The fact that number one, can children have asthma? Yes, children can have asthma. It's not only adults that have asthma. So children can have asthma even as early as 1 year. They can have it, especially if they have very strong family history. But most of us, we usually would diagnose asthma in children after the age of 2 years. So that's number one. Another common myth when it comes to asthma is the stigma associated with asthma. Asthma is one of the most common conditions in children. So it's not something to see as something to be scared of. Let me put it that way. So the child having a diagnosis of asthma is not a death sentence or anything. So it's not something to be scared of, because some parents are so reluctant to get a diagnosis of asthma. They don't even want to entertain it, because I see that by the way parents will say, oh, we don't have asthma in my family, we don't have asthma. There's nothing wrong with those who have asthma. So it's a genetic condition. So it's not anybody's fault that the child have asthma. So the essence of having a diagnosis is just so that we make sure we're treating the child properly. As you have said, as you have seen from our discussion, asthma's medication are different. They are not antibiotics. And most time when children have asthma attack, they don't need antibiotics. They just need something to open up their airway. And the most important is also to know those triggers. So, but if we don't have a proper diagnosis, all the children will just end up getting antibiotics anytime they are coughing or wheezing, because they don't have a diagnosis. So it is important for them to have the diagnosis. So there's no reason to be scared of the word asthma, and there's no need to be scared of the word bronchial asthma, or to be scared of the diagnosis of bronchial asthma. And I know it is not something to put a stigma around. So that is number two thing that I really want to address in terms of myths around asthma. And then the third myth is that yes, children can outgrow their asthma, but some children don't outgrow their asthma, and some will keep on having asthma even as adults. So most of people that have asthma as adults actually started having it as children. Okay, of course, this is not a huge percentage. Majority actually stop, but some will keep on having asthma even as adults. So we should get comfortable with that. And then another thing that I need to address is the use of oral medication. So I see a lot of people using, I'm taking salbutamol tablets, Ventolin tablets, and a lot of, actually in places where due to our health system that is not well structured, a lot of people go to people who are not really qualified to manage conditions, and they just, so I see a lot of people saying they are giving their children as Ventolin tablets, and sometimes they give them daily. This is a very dangerous thing to do. So as I emphasized in the discussion itself, please be very skeptical. The only medication we usually give orally when it comes to asthma, when they have acute episode, is the steroid, maybe the prednisolone. But majority of medication for asthma, they are given through the nose into the airway, or through the mouth into the air. We want it, in the airway. We don't want it anywhere else. So avoid just giving your children Ventolin syrup, Ventolin tablets unnecessarily. Okay, it's better to get the inhaler. And I've told you that even children who are younger than 5, they can use the inhaler. All you need to do is to get the spacer device. Okay, so spacer device, we can show you how to use it, and your doctors or the nurses in the asthma clinic, they can show you how to use it. But avoid just giving children syrup, and these are not, and those Ventolin, for example, it's not a medication to be taken every day. It's a controller, or it's something we use when there is an episode, and usually most times 3 or 4 days we expect everything to have resolved. So the ones that we tend to give every day is the steroids, and that is the one to prevent, and usually will be prescribed by the doctors, and there are different kind of them, like Seretide and all those other brands. They are available, and the doctors will prescribe them. And if your child is on controller, is on preventer, like the steroid medication, you need to be seeing your doctors regularly, because we do adjust the medication depending on the response of the child, and we may even sometimes tell it off if we think the child is much better and do not need it anymore. So, but all that is something the doctors will do. Sometimes doctors, for some children who have other allergic conditions, in addition with their asthma, they may also give you some other medication like etotifen and all those other oral medication. You should just take them as well. Okay, and of course, another very popular myth around asthma is whether asthma is a death sentence, and you have asthma and you're going to die with asthma. No, you don't always have to die with asthma. There are a lot of people who have asthma, who are alive, who are living with their asthma, and they just need to know how to manage it. So it is not. I know we've had a lot of celebrities or popular people who died because of asthma. Most of the time, it's due to lack of proper emergency care. Like they were not able to get them to the hospital on time, and like I said, some episodes could be quite severe asthma that we really need to get them into intensive care and all that. So those are the issues where it happen. But if asthma is properly managed, controlled, then the person will not end up dying, of course, as long as they are managed on time. I think those are the common myths around asthma that I think to address before we round up. So remember, you must have an action plan. You must read about asthma. There are lots of resources for parents about asthma. There's this global initiative for asthma, and I think that Gina, they have a lot of resources online. Please read them, download them. There are material for monitoring the child's responses, so we expect you to take them, and then when you go to your doctors, they will look at it to see how well controlled the asthma is. So um, you should get yourself familiarized with all those materials. They're available, they're free, and you should, as a parent, you should know a lot about them. And no matter how mild your child asthma is, please always have your reliever medication, always have it at home so that if there's any attack, you know what to do and all that. Whereas if your child has been prescribed the preventer medication, you should always take them every day. It's not something you take this month. I know they are very expensive, especially for us that are paying out of pocket. And sometimes, when you have to buy medication every day and when you have to take medication every day, it can be quite uh, stressful for parents and for the child, but it's about making sure the child is better. So let's build it into our daily routine, encourage the child to take this preventer medication all the time. And the reliever medication, like the penicillin and other, they must always have the inhaler with them all the time. Again, that's what I was talking about. In case an attack can happen anywhere. So usually in some places, it's better if they have one at school and they have one in their home bag. Maybe they're on their way home. So it's not like something happened and, oh, where's my inhaler? I know we've watched a lot of Hollywood movies and everyone, where's the inhaler? The inhaler is not available. They should always have it available. So, and then you must always follow the action plan. You must always have a plan with your doctors. And if things seem not to be getting better when you're following what you are supposed to have done, because most of the time you manage the asthma at home by yourself. It's one of the areas where we encourage self-medication. So if a child is having an attack, we encourage you to self-medicate the child, give the child the inhaler. But we also want you to be wise and prudent. If you think you're doing the right thing and the child is not getting better, then that is a time for you to take the child to the hospital. So I think that is all our asthma today. I'll just take a few questions on common question parents ask about asthma. Somebody asked, do I wake up my child just to give them the asthma medication if they are sleeping? So if a child is sleeping, the child is fine, the child is not having difficulty with breathing and all that, you don't need to wake them up to give them the medication. For the preventer medication, we want to give them in the daytime. Usually, most of them are once daily, occasionally some of them are twice daily. So you give them maybe the same time each day, 7 a.m., 7 p.m. So it would have been before their bedtime. So you don't really need to wake them up to give them medication. Then another question is how much activity? Again, I know that we're trying to say exercise is one of the things that can that can trigger off an asthmatic attack. So a lot of parents are now so cage the child who has asthma, so you can't play, you can't run, you can't do this. No, that is not true. Actually, when the asthma is controlled, once the child is taking the preventer medication and they are not having so much episode, they can actually do as much activity as they like. Okay, there's no reason to restrain them or restrict them. They should have normal childhood. But if they notice that maybe some particular form of very tasking exercise tends to trigger heart attacks, then you may want to avoid those ones and look for alternatives. Like swimming is a very nice one for people who have asthma because it doesn't affect their airway as such. It actually cools it because the water tends to soften any dryness and all that. So you just let the child enjoy whatever they like, and so you don't have to limit them. You don't have to like, don't do this, don't do that, So please, you should just let them be. Then another question is that if a child who has asthma has like a chest infection that they haven't called for catheter, should you immediately start them on antibiotics? No, you shouldn't. Most children, as we always say, the cold and cough without fever, without breathing difficulties, they are just viruses caused by viruses. So most of the time they will resolve by themselves. So there's no need for you to give them antibiotics. So, and again, like I said, asthma must be diagnosed. So when a child is having an attack, don't just go rush them on antibiotics. Most of them just need to use their inhaler and they'll be fine and all that. Some people ask, is it safe to give my child prednisolone? Which is a steroid. And I notice a lot of parents do this. So they have all this medication at home, and we really prefer you don't use steroids on your own without a doctor prescription. Number one, steroids have a lot of side effects. Number two, we have to give the right dose and we have to use for the right duration. Most time we don't want, for asthma, we only give it for a short course, maybe 3 days, not more than 5 days. So we don't want, it's not a medication we want you to be taking all the time. So preferably let your doctors be the ones to prescribe. I know sometimes we've prescribed so much medication and you know what we normally prescribe. And most of us in Africa, Nigeria, we can easily buy this medication off the counter even without prescription, but that does not mean we should still do that. It's wrong. So the only medication we want you to use at home for yourself is just the inhaler. That's all. But steroids and every other thing, antibiotics, we will leave that to when we see our doctors in the hospital, and then the doctors can be the ones to prescribe it. And then usually they would have known the right dose and they would have told you the right duration of asthma, those kind of medication, if we are prescribing them in a child who is having bronchial asthma. All right. Thank you so much, everyone, for listening to me today. If you still have any question about bronchial asthma, feel free to head over to Ask the Pediatrician Facebook group. Post your questions there, and we will try and answer them as soon as possible. We will surely answer questions 24 hours daily, Mondays to Saturday. And so you can always ask your questions there. And remember, there are lots of asthma clinics in most general hospitals or teaching hospitals nearest to you. So just go there and inquire if you think your child needs the services, and make sure you go there regularly based on the appointments they give you. So thank you so much, everyone, for joining us today. Until I see you again next week, when we're going to be talking about another important topic about the health of our children. I want to encourage you to stay safe and keep healthy. Thank you so much, and it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.